Hi, everybody. This question comes from our monthly Ask Dr. David live YouTube series. Hope you find it helpful.
Would taking hormones be safer for a woman dealing with premenstrual symptoms? Is it true that taking progesterone increases the risk of cancer? And are there any holistic alternatives or supplements with premenopause that can help with premenopause symptoms like fatigue, depression, dizziness, very long periods? Okay, so again, from a functional medicine perspective, of course, looking at all of those basics, the diet, the nutritional deficiencies, gut microbiome, etc. Now, also, one of the things that we do here in our practice is we actually look at the hormone levels themselves. Right. So if a person was actually showing that they had suboptimal or they were deficient in progesterone, and getting them into a regular range would be different than just someone starting to take progesterone. Right. So I think it is important to kind of check to see what's going on. And of course, there could be some progesterone sensitive types of conditions. We know that breast cancer, ovarian cancer, there can be sensitive forms of those. Of course, you're maybe talking about preventing that from happening. And so looking at, family history, are there any types of cancers that are hormone dependent, have, BRCA genes and other types of genes, that are associated with, hormone sensitive conditions would be something that would be worthwhile looking at as well. Now, there are certainly supplements that people will use. I've seen high dose omega-3 fatty acids, magnesium and vitamin B6 can be helpful. I know vitamin D can be helpful as well. I've heard of some herbs, but I think that kind of depends on the individuality. So, again, working with somebody who has a keen knowledge about female hormones and menopause, premenopause. Now, as a pediatrician, this is where I get to pull the pediatrician card out and say, this is not an area of expertise for me at all, but that's why I have other providers in the practice who can answer those types of questions. But certainly, that is an art unto itself, right? And it's one thing that, for a child who has a thyroid deficiency, etc., or if puberty wasn't moving forward, and you look to see if any of the sex hormones were off. But even in that situation, I would be, if I found those, and those are things that I test with, I would be wanting to work with a pediatric endocrinologist in that situation as well. So again, as with everything else, it's a very individual thing, but I wouldn't necessarily rule out progesterone right off of the bat just because of those concerns, but it's something to be mindful of.
If you like this video, please see the description below and click the link for the full episode. And if you haven't already, please subscribe to this channel and join us on social media.